It's an evolving challenge, and I think that the recommendations are also an evolution. So I think that as it stands right now, you're right. COVID-19 can present with a lot of different symptoms, some extremely mild, and in fact, people can be infected and contagious with no symptoms that they have known about. But if you have a new headache, a new sense of fatigue that's not associated with staying up all night or working very hard for days on end, you have a fever, those are all things that right now we don't have other good explanations for besides COVID-19. And so if you can get to testing, I think that's really what we want to see happen. I think if they're worried, they should get tested, right? Because that's really going to tell them what needs to happen. And the reason that that's so important is that from the individual perspective, that one person, is that the duration during which they can transmit to other people is longer than I think the way we think about it when we have colds. And if you can't get to a test, kind of assume that you have COVID-19 and follow those public health recommendations around duration of isolation. It's tough, I recognize that, but we really need to keep people as safe as possible to reduce new infections. We are still deeply in a COVID-19 epidemic. This epidemic is not ending anytime soon. And I think that in conversations I have with a lot of non-medical folks in my community and in my friend circle, is that sometimes they seem to be thinking in the short term, kind of weeks or maybe a month or two. And what I keep reminding them is, no, we need to be thinking in the smallest time block here is 6 months. And probably a healthier time block to think about mentally is a year. And that means that we need to be taking responsibility for us, our loved ones, our family, our friends, our community, and everyone else around us. And that means wearing a mask whenever we go outside, right? Wearing a mask whenever we're going to be within 6 feet of everyone. Living by that distancing when we don't have masks on, right? I think we can definitely ride our bikes and go for runs without masks on, but that means that we're not going to cluster together or meet up with a whole bunch of other people. Again, mental model, thinking about a year of sort of new behavior. And that means that if you're not bought into it yet, now's the time to do it, because it's not going to go anywhere. And until we get this solved through widespread vaccination or something similar, this is the way of life.